Hello good people, welcome back to Community Medicine, a channel where I discuss matters health. Men, this video is for you. Make sure that you join me till the end. So today we are going to be looking at the use and the misuse of sildenafil, commonly known as Viagra or the blue pill. So sildenafil was initially meant to treat pulmonary hypertension, which is an increase in pressure in the arteries found in the lungs. So in the process of treating pulmonary hypertension, the researchers realized that sildenafil was causing frequent erections as a side effect, and that is how it ended up being used for management of erectile dysfunction. So how does it work? It works by inhibiting a certain enzyme, thus causing relaxation of smooth muscles, and this in turn causes an increase in blood flow to the muscles. So sildenafil or Viagra comes with a number of side effects, especially if not used correctly. And actually we've had or we've lost a number of our men from the misuse of Viagra. So some of the side effects are blurred vision, dizziness, severe headaches, we have nose bleeding, we have loss of consciousness, we have priapism, which is painful prolonged erection, which actually can go past 4 hours, and we also have loss of consciousness and cardiac arrest in extreme cases. Now, erectile dysfunction has a number of causes, and I'd actually done a video on erectile dysfunction previously. You can revisit the video. And some of these causes include chronic conditions like uncontrolled diabetes, uncontrolled hypertension, cardiovascular conditions, we have obesity, lack of exercise, unhealthy diet. We also have conditions like proctitis, which is inflammation of the prostate gland. We have benign prostate hypertrophy, common in the middle-aged men. We have cancer of the prostate. We have stress, depression, anxiety, or emotional instability. And erectile dysfunction can also happen as a side effect of certain medications. There are reasons, or there are a number of reasons why you shouldn't take Viagra without a doctor's prescription, and some of them is the side effects that we've just talked about. Another reason is because will be masking the real cause of the erectile dysfunction, untreated condition or infection. And then something else is drug interactions. Taking Viagra with certain medications, for example nitrates, which are used to treat angina pectoris, would come with undesirable side effects. It's like a drop in the blood, further drop of the blood pressure. And then another reason why you shouldn't take Viagra without a doctor's prescription is because it could be a sign or a marker of an underlying cardiovascular condition. And this is because for an erection to happen, there need to be a proper blood circulation and healthy arteries. So in case of a cardiovascular issue, the small arteries in the penile tissue will first be affected before the large arteries in the heart. So this could be a warning sign of an underlying untreated cardiovascular condition. So if you take Viagra without having visited the doctor, it means that the underlying condition will not have been addressed, and it could actually get worse. Now, unfortunately, there's a lot of sale or purchase of Viagra as an over-the-counter drug, which should not be the case, because it should be a prescription-only drug. So the fact that it is readily available makes our young people abuse this drug, not because they have an erectile dysfunction, but because they feel like they need to boost their erection or they need to last longer. So they end up misusing or using this drug time and again. And unfortunately, this leads to psychological dependency meaning that these young people will not be able to have a sexual performance without having first taken sildenafil, because they'll feel like they do not have the power, which is actually all in the brain. So another issue is that the use of Viagra with other recreational drugs would also bring undesirable side effects. Now, if you're experiencing an erectile dysfunction, make sure that you go to the hospital, visit a doctor, have yourself screened, have yourself checked, and this way the doctor will be able to treat the real cause of erectile dysfunction. And if there is need to take sildenafil or Viagra, they'll be able to advise you accordingly on the dosage and the duration. Don't self-medicate, because this is just a quick fix, and unfortunately this is only causing more harm than good. Thank you so much for your time. Make sure that you subscribe, you like, and you share this video. I'll see you in the next, and bye.